Hey, this is Dr. Dickerson coming to you live, Facebook Live at Fayetteville Plastic Surgery and Cape Fear Aesthetics Medical Spa. So a lot of people have asked me, what is this thing about ThermiDry? We're going to give you just a few minutes of a quick overview to keep you dry even in those hot months. So hyperhidrosis, that's the fancy word for I sweat a little bit too much. I'm keeping shirts in my car, changes of clothes, and I'm really getting embarrassing situations, whether they be with your husband on a date. But guess what? Most people are not alone. As you can see, 3% of the population, over 200 million people, have this social embarrassment. So what can we do about this? Now, there's basically things that have been going on throughout the years to help with extra sweating, especially in the armpits or axilla area. They include some homeopathic therapies, crystals, other topical procedures. We've even used underarm liners in our dresses and our suits. Of course, topical antiperspirants, either over-the-counter or even prescription ones. And what about our favorites out there, our neuromodulators, our Botox, our Xeomin, our Dysport? And there's also a procedure called ionophoresis, where we use to actually try to knock out the nerve. And even, believe it or not, liposuction will work. Just basically rubbing underneath the skin with the cannula when we're, let's say, taking out that extra fat in the little spot right here by the breast tissue or on the back helps out a considerable bit. The neuronectomy is a fancy word for actually us cutting the sweating nerve, a little bit more involved. And then we have, of course, microwave therapy by some of the commercial techniques that are out there. And what I'm going to talk to you today is radio frequency. So what is happening underneath the skin? So I want you to think of course, this is our skin layer right under our armpits. And we have two types of sweat glands. We have the eccrine and we have the apocrine. Now the eccrine is one that we like because it keeps us cool. That's why we sweat to regulate our temperature. But it's the apocrine gland that a lot of us are worried about because that's the one that makes us with the stinky armpits. And so this is why we have the combination of the antiperspirant and the deodorant. And of course, we can actually do this just through small little injections, whether or not we're using neuromodulators or using the radio frequency. So, what do? For some people, they need a little bit of calming, so we give them a little medicine called Halcyon. It's kind of like Valium. Just kind of takes the edge off. We put some numbing medicine there so they don't feel it, so believe it or not, we don't even need the relaxing medicine, so people can actually drive in and drive home. Now here's a quick idea of where we use and how we do this. So this is all it is, just a little pinhole about the inside of a big pen. We make one or two small little holes in the maxilla. We actually use the regulated temperature to basically tell those sweat glands to go to sleep. And it can last for up to 2 years. The procedure takes about 15 minutes aside, there's no downtime, and you can go do your regular activities. Most people will see a difference in about a week, and it can last for the most part, literally, like I said, 18 months, 2 years. Some people need a little neuromodulator, a little Xeomin or Botox, just to help the situation out if they really, really sweat a lot. So this is one of my favorites. So just imagine you can stay potato chip dry for about 1.5 to 2 years, whatever happened to worrying about changing a suit, having a change of clothes or avoid those embarrassing situations. So that's ThermiDry. But we have one more special thing for you. It's called ThermiRase. Now ThermiRase uses the same particular technique, but instead of us knocking out the sweat glands, we can knock out those nerves. That especially gives us the number 11 signs that we usually do for our Botox or Xeomin. And one of my favorite is the neck muscles. So once again, ThermiDry for the sweating, ThermiRase for the nerves. This has been Dr. Edward Dickerson at Fayetteville Plastic Surgery and Cape Fear Aesthetics. We hope to see you soon.